Joining us now live is Congresswoman Alexandria Ocasio-Cortez of the great state of New York. Her district includes portions of the Bronx and Queens. Of all congressional districts in the country, hers appears to be the hardest hit so far in terms of the impact of this virus. Congresswoman, I know you have a lot on your plate. Thank you so much for making time to be here with us tonight.
No, of course. Thank you for having me.
I can tell from looking at the hospitals in your district and right on the border of your district, the hard-hit nursing homes in your district. I can tell from looking at the overall borough-by-borough numbers in New York City how badly your constituents are suffering right now and how many of them have been killed by this virus. But can you just tell us more about that in terms of what your constituents are telling you, what they're asking from you?
I mean, their requests are absolutely reflecting how dire this situation is getting, and they're also reflecting the lack of adequate federal response. 2-3 weeks ago, people were concerned about unemployment. They were concerned about stimulus checks. But now that rent payments have gone out, now that we have another rent payment around the corner on May 1st, people are now asking about food assistance. People are now scared to leave their homes. There are people that are scared to answer the door when food does come because we're getting reports of continued ICE activity throughout this pandemic. And so what we're really starting to see is people going from, I don't know how to pay my rent, to I don't know how I'm going to eat next month, because 43% of Americans right now have either had their incomes dramatically reduced or completely ended overall. And this crisis, that aspect of this crisis is a choice. And it is a choice that Republicans are affirmatively making right now by denying people the recurring payments and the amount of aid that people need. And when it comes to the health impacts that we have right now, we still need PPE. Hospitals, thankfully, we're starting to get to the levels that are necessary, but we still have home health aides. We still have nursing home workers. We have plenty of people who provide health assistance that aren't necessarily in a hospital or a clinic, but are going into the homes of vulnerable people and the elderly that do not feel like they have the support or the assistance that they need right now.